For Ron Cothran, obesity has been a lifelong struggle.
I had always been a chubby kid. Was the one that wore husky jeans growing up, and the typical kid made fun of because of weight and things.
He gained more than the freshman 15 in college, and he kept adding the pounds long after, despite his best efforts.
I tried several diets, different things of that nature, and finally bloomed up to a little over 350 pounds.
Now a type 2 diabetic with high blood pressure and sleep apnea, Cothran says he felt his only option was bariatric surgery.
So this, I felt, was probably my last resort. I was probably about the end of my rope when I decided to do it.
And so he opted for the gold standard in weight loss surgery, the gastric bypass. The surgery itself went well, but just 3 hours later, the first problem.
My heart rate was going up, my blood pressure was going down, my color was changing. So it was determined that they wheel me back into the OR and then open me up.
The issue, a leak in the connection between what was left of his stomach and his intestines.
And it was determined that I probably lost about half my blood volume in that time.
Surgeons quickly fixed the problem, but Cothran also faced several bouts with dumping syndrome, where his body rejected the food and nutrients he was eating. Dr. Edward Lin, surgical director at the Emory University Center for Bariatrics, says complications like Cothran's are uncommon, but can be very serious.
Leaks after a gastric bypass can happen from 2 to 5% of the time. Dumping syndrome is one of the things that people like to talk about a lot. In reality, it doesn't happen that much.
Lynn says he tells patients to be aware of the risks.
When we talk about complications, we do not only talk about the percentages or the risks and how frequently this happens. We really talk about planning for the complications.
And not just physical, but psychological and financial complications.
We really spend a lot of time talking about the lifestyle issues, the social complications that come with this. When you lose a lot of weight, those people who were your friends may no longer be your friends anymore. It is very devastating when you are in the intensive care unit for a while and you can't go back to work, or the economic burden that's placed on your family.
Lynn says the key before having any surgery.
You want to be at a place where you know everybody's going to do a good job. But the other important piece of it is looking at what happens if there is a complication. Is this group able to take care of it? Do they have the team, the resources to do it? And that's what you really want to be asking your doctors.
As for Cothran, he says despite the complications, he'd do it again in a heartbeat.
If I was going to have the same complications over again and knew it, I would go ahead and do it again, without a doubt. It gave me my life back. It saved my life. I have no doubt about that.
I'm Susan Hendricks.
This is a reading of Weight Loss Interventions That Work, Surgery, on CNN, dated June 20th, 2018, by Lisa Dreyer. Do you have pounds to lose but don't have a weight loss plan? If you are seriously considering how to go about shedding pounds, there are 3 proven levels of intervention depending on your individual needs. 1, lifestyle changes. 2, medications. 3, surgery. If you are severely overweight and have not been able to lose an adequate amount of weight with lifestyle changes or weight loss medications, or if you have serious health issues related to obesity, bariatric, or weight loss, surgery is a potential option. You consider surgery when other therapies for obesity fail, said Sue Cummings, a registered dietitian who was clinical programs coordinator at the Massachusetts General Hospital Weight Center for the past 20 years. The person has been through everything, and now they have diabetes, hypertension, sleep apnea, arthritis. That's when you would really start to think about surgery. Bariatric surgery procedures. Weight loss surgeries performed in the United States include gastric bypass, sleeve gastrostomy, also known as gastric sleeve, and a procedure called biliopancreatic diversion with dual dental switch. The latter has the best outcomes in terms of weight loss and remission of many medical conditions associated with obesity, according to Cummings. However, it also carries the most risk. The adjustable gastric band is another option, though long-term risks associated with the band have led to a significant decrease in surgeons performing the procedure, Cummings said. The criteria for bariatric surgery include a body mass index of 40 or higher, or more than 100 pounds overweight, or a BMI of 35 or higher with health problems including type 2 diabetes, high blood pressure, heart disease, or sleep apnea. A BMI of 30 or more with a serious health problem is indicated only for the gastric band. The surgeries result in weight loss for two reasons. They reduce the amount of food one can eat, and they cause changes in hormones produced in the intestines that help reduce hunger, increase fullness, and regulate blood sugar. For a detailed description of how the different weight loss surgeries work, check the American Society of Metabolic and Bariatric Surgery's online guide. In essence, the reason most bariatric surgeries are so effective in producing long-term weight loss is that they strongly affect the physiological regulation of body weight, interfering with signals that defend against starvation and weight loss, Cummings explained. This ultimately changes a person's set point, or the level at which weight tends to stabilize. Surgery literally changes how your body regulates body weight. For example, the fundus, or upper part of the stomach, is the main site where ghrelin, a hormone that stimulates appetite, is produced. After the removal of the fundus in the gastric sleeve, the production of ghrelin is significantly reduced. In the gastric bypass, and to a lesser extent the sleeve, there is an accelerated delivery of nutrients into the portion of the small intestine known as the hindgut, which causes an increase in secretion of hormones that inhibit appetite and induce satiety, according to Cummings. Benefits and risk. An individual's response to weight loss surgery varies, although on average, people who have bariatric surgery lose 15 to 35% of their starting weight. Gastric bypass tends to result in more weight loss than the band or gastric sleeve, Cummings said, though every bariatric procedure study demonstrates similar wide variations in outcomes among patients. As a consequence of weight loss, bariatric surgery can improve many health conditions related to obesity, including type 2 diabetes, sleep apnea, high blood pressure, high cholesterol, acid reflux, and joint pain. In gastric bypass, improvement in diabetes occurs within days of surgery and is independent of weight loss. The reason is due to hormonal changes, which enhance insulin's response to nutrients, Cummings explained. The benefits of weight loss surgery do not come without risks and long-term considerations, however. About 10 to 20% of patients fail to lose a significant amount of weight, and others experience significant or premature weight regain, Cummings said. Complications of surgery may include infection, bleeding, poor absorption of nutrients, or dehydration early on, as well as ulcers and hernias. A side effect of gastric bypass known as dumping syndrome can occur shortly after eating and may result in nausea, dizziness, weakness, cold sweats, cramps, and diarrhea. Long-term outcomes vary as well. According to one 12-year study of people who had gastric band surgery, 1 in 3 experienced band erosion, and nearly half of the patients needed to have their bands removed. It's important to recognize that lifestyle changes after surgery are extremely important. That includes avoiding many food temptations that surround you, such as fast food, french fries, and the scones at the local coffee shop. Surgery is not going to change the environment. Therefore, combining lifestyle changes with surgery will produce the best outcomes. Those changes include eating more whole foods, avoiding refined and processed foods, and increasing physical activity each day. Additionally, lifelong supplementation of vitamins and minerals, including iron, calcium, folate, vitamin B12, B1, and vitamin D, is required. The risk of deficiencies increase as patients progress from surgery, so all patients need to have their nutritional labs monitored yearly for life, Cummings said. The decision to have weight loss is not an easy one. The decision to have weight loss surgery is not an easy one. Every patient needs to be fully informed of the risks and benefits and should be evaluated by multidisciplinary teams, including a surgeon, a doctor, their primary care physician and/or an obesity medicine specialist, and a registered dietitian and mental health professional, Cummings explained. Additionally, a full benefit risk analysis should be performed. Do the benefits outweigh the risk? If so, surgery is the most effective therapy, Cummings said, adding that data show an increased life expectancy due to the remission and/or resolution of over 190 medical conditions associated with obesity, such as type 2 diabetes, heart disease, sleep apnea, high blood pressure, kidney failure, and more. This has been a reading of Weight Loss Interventions That Work, Surgery, on CNN, dated June 20th, 2018, by Lisa Dreyer. This reading has been brought to you by Women's First OBGYN in the Hampton Roads, Chesapeake, Virginia region. Women's First offers a host of aesthetic solutions for weight loss. We offer Sculpture permanent fat removal, which is completely non-invasive. We offer SmartLipo Triplex permanent fat removal, which is semi-invasive. And we offer a managed weight loss program, which gives you individual food plans, individual coaching, and individual education to help you transition to a thinner, healthier lifestyle. With our Smart Lipo Triplex, the reason it is called semi-invasive is that it is not going into any of your organs. It's simply zapping and sucking out the fat that sits on top of your muscles. Call today for your Smart Lipo Triplex appointment. Get all the benefits of weight loss surgery without any of the risks.